Hello, everyone. Welcome to the webinar. I'm watching the number of participants tick up quickly, so I'll give it a few seconds to fill the room before I begin. First off, huge thanks to everyone. It looks like we have people from dozens of different countries joining us. So though some of our research is specific to Canada, it seems well recognized that this is a global challenge. So we're going to talk today about vaccine hesitancy, in particular taking a behavioral lens on this critical problem, which as noted is impacting Canadian life and industry as well as the world at large. In terms of what we are going to cover today, on the agenda, we have a number of sections here. So to start, I'm Nathaniel Barr doing the introduction for just a few minutes. We're going to hear from Kelly Peters, the CEO and co-founder of BEworks and the lead investigator of this report, talk about how public health and business leaders should be thinking about vaccinations from a behavioral lens and why this challenge is so intimately tied to the human mind and behavior. Next, we'll review some of the key findings from our recently released report on vaccine hesitancy from Pierre Jean, one of our associates. Next, we'll have a brief discussion with some of our key project partners before moving into some of the scientifically backed solutions to vaccine hesitancy that we think should be under consideration and being put into action. And we'll close out with directly that, thinking more about what it means to take learnings from this research, ideas from behavioral science, and getting them into the field to help push societal change on this critical issue. Before getting into the substance of the webinar today, I just briefly wanted to touch on introducing some of the core people that were influential in this report and the broader initiatives we have underway made it possible. So Kelly Peters, who I already mentioned, our CEO and co-founder, is really the person that drove this work. It came about through a simultaneous recognition of the crucial need in society to take on this challenge and finding ways to integrate what is known in behavioral science toward this challenge, as well as a desire to contribute to the forefront of knowledge generation in this space. Myself, I acted as a co-author of the report and a contributor to the study. We have a number of the BEworks team that played critical roles in the execution of the research we're talking about, as well as finalizing and figuring out what we want to say about solutions. So Angela Cooper, Pierre-Jean Mel, Eric Rote, and Sarah Carpentier, a few of whom you'll hear from later today. Also, beyond the BEworks team, we have a number of contributors that are worthy of note on the next slide here. So we had a number of researchers that facilitated the formulation of the questions we asked that you'll hear about today. Jacques Bougan, has a number of affiliations, and in addition to his critical work on helping us understand the Canadian context, is a forerunner in understanding vaccine hesitancy in Europe and around the world. We also received contributions and guidance from Dr. Gordon Pennycook, the University of Regina, who's conducting a vast array of studies related to COVID-19, in particular around misinformation. We, of course, always have the support of Warda Malik, who's our Chief Marketing Officer here at BEworks, who will be the one talking more about taking these insights to action, as well as a number of key partners from the 19 to 0 coalition, of which BEworks is a part. So we have Dr. Jia Hu joining us, who's a co-founder of 19 to 0 and a clinical assistant professor at the Cummings School of Medicine in Calgary, and Dr. Noah Ivers, a clinical scientist at the Women's College Hospital. And in addition, we have Adam Froman, the founder and CEO of Delvinia, who played a critical role in our capacity to conduct this research. So John, Noah, and Adam will be joining me later in the session to talk a bit more about their role and their views on the role of behavioral science as it relates to vaccine hesitancy. So that sets the stage for now. I'd like to pass it off to Kelly Peters, who's going to get us going on thinking more deeply about vaccine hesitancy and behavioral science.
Thank you so much, Nate. As always, it's a joy to lead these kinds of initiatives with you. The thing about science is it takes a community. All of science is this idea of building on the shoulders of giants, building on prior research, building on the insights that we have, and challenging each other and using the scientific method itself to develop experiments and scrutinize our observations and scrutinize our hypotheses. So it very much takes a community. But science is interesting. Science, biological sciences have brought us the vaccine. Epidemiologists have helped advise our policy positions with careful mathematical modeling. But now there's an opportunity for us to engage in the behavioral sciences. We have an expression which is that vaccines don't save lives. It's the act of receiving a vaccination that does, which means it's a behavioral challenge, which means that people who have an interest and knowledge and expertise in the science of belief and behavior need to now be summoned to do their part, the final mile, in helping us end the pandemic through understanding the barriers to vaccine demand. So let's take a look. Dr. Fauci has explained to us that we have a mathematical challenge ahead of us, which is that we need the vast majority of our population to receive both doses of the vaccine, which means 75 to 85% is a big hurdle for us to be able to climb. But unfortunately, the barriers are very complex. And these are the numbers on the next slide that we all need to familiarize ourselves with. And this is this issue of vaccine intentions. So here's what we have in front of us. We have, a slight majority that are ready, willing, and able to get the vaccine. But then this is where things become very crucial. And I know many of you have already had conversations with friends, family, constituents, patients, but we need to understand deeper what these barriers are. So we have about a third that are what we would classify as on the fence with their vaccine intention. When we ask them if you want to get the vaccine, they said, I'm not sure yet. And we want to talk about that today. And then we have another group that has a firm no as their response. And we need to understand what's going on there. And we need to look at some solutions to help us get past that. Just one other point here. It's perhaps reassuring, or maybe not, depending on which way you want to take this. Our polling data here is very consistent with what other leaders in this space in polling and in understanding human attitudes towards health behaviors. For instance, Angus Reid has done extensive work. The Kaiser Family Foundation has done extensive work. And our own was very aligned to that and to their findings. But we took it the next step. We wanted to go deeper. We wanted to apply the behavioral science lens, which is this understanding of why people believe what they do. We wanted to understand what the particular barriers are. Behavioral science is all about understanding how people think. And for those of you who are familiar with this field of research, you might have come across things like this idea of behavioral economics is all about just how we make decisions. So our research is based on, first of all, let's just understand what it is that people know about science and how does that shape their attitude towards getting the vaccine. Now, Pierre-Jean will be talking to you about this in a little bit more depth, but I just want to give you a preview. So that scientific knowledge would be people's ability to answer questions correctly, such as, is an atom bigger than an electron? So we ask people those kinds of questions about their scientific knowledge. And we ask them about their openness to evidence. And I love the questions that we've asked here. There's some really fascinating research about this whole issue of beliefs and facts and fake news and all of that stuff. There have been some questions that have been explored around how we view evidence. And here are two of the questions that we asked. And it's, how strongly do you agree or disagree with the following statement? So here's one of them. Just because evidence conflicts with my current beliefs does not mean my beliefs are wrong. I want you to think about that one. And then the second one is, regardless of the topic, what you believe to be true is more important than evidence against your beliefs. Now, for those of you who are scientifically oriented, how can these questions even be a question? We should all strongly agree that the evidence should trump what our personal beliefs are. But what we found is that many people actually believe that their own beliefs are more valuable than the actual evidence. And that makes the challenge in front of us difficult. And last but not least, one of the other dimensions that I wanted to highlight here is intuition versus analytical reasoning. And this is where behavioral economics was really born, was studying this system 1 and system 2, as we like to call it, decision making. System 1 is when we're really fast and don't spend much time. We're very frugal with our time and energy that we spend in thinking about something. And system 2 is when we're very slow and deliberative about how we're evaluating, for instance, the quality of information, the credentials of an expert, the validity of information that's in front of us. So when we applied that here, that translated into asking people questions like this one. A lily pad is growing in a pond and doubles in size every day. After 30 days, it covers the entire pond. On what day does it cover 1/2? When we ask people that question, and again, we see that people that answer that question and other cognitive reflection tasks, is what they're called, incorrectly, we see some very interesting things. Now, I'll let Pierre-Jean walk us through what that data tells us, but those are some of the things that helped us understand what it is that people know, how do they think about evidence, and generally, how do they approach information? And we learned a lot. And that brings us to what some of our key concerns are. That's what brings, I think, all of us in this session together today, and hopefully our conversation will continue. This isn't an exhaustive list, and I'm sure that you all have many other concerns that I would love to know. These are some of the ones that we're thinking about. First of all, intentions do not equal actions. This is related to our second point. We're worried about the people that we said, that 60% that we uncovered that said that they're secure. We're worried about them. And we're going to talk some more about that group as well. Sarah Carpentier in her section of the presentation will talk even further about some of the concerns that we have for those of us who have very strong intentions. And we're worried about the on the fence not coming on board with taking the vaccine. We need them for the herd immunity. And then last but not least, we have misinformation and disinformation that's continuing to spread and having a negative impact on our society overall, attitudes toward science in general, and of course, specifically with this social challenge, an economic challenge that the pandemic presents to all of us. So these are some of our key concerns that we hope together we're able to address. So with that, I'd love to introduce my colleague, Pierre-Jean, to take us deeper into the data. Thank you all.
Thank you, Kelly. So as Kelly said, we ran the study in December, and we collected answers from about 4,000 Canadians from all over the country. And what our study was really focused on, there were 3 main parts. The first one was about the intent to get vaccinated. Kelly already talked about it a little bit earlier, if you remember. About 60% of the people who are currently secure, about 1/3 who are on the fence, and about 10% who are opposed to the vaccine. This was the first part of our study. And then we asked a wealth of questions regarding cognitive factors that we knew that we had a strong idea coming from the scientific literature would be predictive of how people think about the vaccine and then their intent to be vaccinated. So we really focused in this part on the cognitive factors underlying decisions. And finally, in the last part of the study, we asked several questions regarding demographic factors, and I will explain this 2 parts in more detail over the next few slides. But very importantly, on the next slide, the really main crucial results that we observed is that we identified 4 cognitive factors. There's 4 cognitive factors here that I will describe that explained 43% of the vaccination intention, whereas the 14 demographic descriptors that we asked combined These are all the demographic factors that you can imagine, like linked to age, social economic status. All these demographic factors combined only explain 14% of the vaccine intention. And I really, really want to insist on this fact that by focusing on how people think instead of who people are, we tripled the accuracy of our prediction regarding vaccine intent. And that is really the crucial part here. So if we look at these 4 cognitive factors that were instrumental in describing and in predicting vaccination intention, we had belief in conspiracy theories, we had scientific knowledge and valuing personal belief over empirical evidence, and finally, we had vaccine risk concerns. And I will touch on these 4 factors over the next few slides. So on the next slide, you will see that the fact that these cognitive factors are strong predictors of vaccine intentions cannot be better illustrated than by this beautiful correlation that you see here on the right part of the screen between belief in conspiracies and intent to get vaccinated. Basically, the more people believe in conspiracies, the less they intend to get vaccinated. But very importantly as well, here you can see that most respondents, if not all of them, have some level of belief in conspiracies. And it's a very important point to highlight here. It's just how widespread belief in conspiracies is. There are a lot of people with zero belief in conspiracies. And when I say belief in conspiracies, I mean, as you will see on the next slide, that I mean belief that vaccines can cause autism, or belief that vaccine contains nanobots controlled by the 5G network. And so it's a very widespread array of conspiracies, but very importantly, individual conspiracy beliefs are not held in isolation. What I mean is that people who believed in one often believed in all of them. And there is a reason to that. And the reason is their point of view regarding the world. They believe that it's possible that there are shadowy networks of people with malevolent intentions who can execute mass hoaxes on the public in near perfect secrecy. And it's a way of thinking, it's a way of considering the world. And we could be tempted to dismiss them. It's easy to dismiss them as the crazy tinfoil hat people. But remember, we saw on the previous slide that there is some level of conspiracy thinking in all vaccine hesitant people. Everybody here has some level of conspiracy thinking. It's just that one fringe of the population. So now, why do people believe in conspiracies? We know that this conspiracy belief is very important in determining how people consider the vaccine. Now, why do people believe in conspiracies? And we found, as Kelly touched upon a little earlier, we found that scientific knowledge was lower in vaccine hesitant individuals. So when we talk about scientific knowledge, we talk about statements, as Kelly said, that, for example, electrons are smaller than atoms. Is it true or false? Or antibiotics kill viruses as well as bacteria. Is it true or false? People who tended to have higher conspiracy belief and lower intent to get vaccinated also had this lower science knowledge. And this problem was even compounded by another issue, that they expressed close-mindedness. Kelly cited a few of the statements that we tested, like whether something feels true is more important than evidence. Yes or no? How do they feel about that? And it turns out that people who have this poor science knowledge and who have this who value their belief over empirical evidence also had lower intent to get vaccinated. And what does it mean? Well, it means that providing empirical evidence to correct misinformation will not be effective for these individuals. these individuals, as I said, they value their belief over evidence. So providing more evidence to them is not going to work at all. And finally, so we're talking about cognitive factors, but we did not mention the concerns that seem to be the more widespread. People have genuine concerns about this vaccine and its side effects. And actually, if you look at the media, it's the most commonly reported worry across recent surveys. People are worried about safety risks such as possible side effects or lack of trust in the speed of the vaccine development. And it might feel intuitively that it is the most important part, but turns out it is important, but it's not crucial, and it's not as crucial as we could expect for a few reasons. First, very surprisingly, these vaccine risk concerns are not as predictive of vaccine hesitancy as we could have expected. You can see in our results here that people who are opposed to the vaccine have just the same level of concern as people who are on the fence, which is not that much more than people who actually are secure. So it means that this vaccine risk concern correlates a bit, but not as well as we could have expected with vaccination intent. On top of that, when we're asked why we're taking a decision, we want to give a good reason for that. We may prefer to say that our decision was influenced by safety fears, and we may want to prefer downplaying other factors such as emotions. So really, when in a situation where our emotions are in charge, we're not comfortable disclosing the real reason that underlie our decisions. And finally, as illustrated by what I just said, these vaccine risk concerns do not fully reflect the psychological factors behind the concerns. So we talked about emotions. If there is an underlying psychological factor that expresses itself with one of these concerns, if one of these concerns is defeated, the underlying motivation is still there. It's not been addressed. And therefore, it will create a new concern that will quickly replace the first one. So what is very important here is that everybody has some degree of concern. It is important. Vaccine safety concerns certainly play a role. I'm not saying the opposite here, but evidence should be provided to help individuals understand the safety risk of vaccinations. But a wealth of scientific research, including our research, cautions against assuming that as on the surface attitudes should be the only focus as dominant drivers of decisions and behavior. So finally, on the next slide, typical strategies that we can see right now rely on providing clear, consistent, and accurate information. And it is important, but it is not going to be enough to reach herd immunity. This traditional information and awareness campaign aim at increasing awareness. Turns out we don't really have an awareness problem. No one is not talking about the vaccine at the moment. It is the key discussion point everywhere. So healthcare and governmental authorities are eager to reach people whose doubts or opposition to vaccination threaten to weaken the public health impact of rollout. But turns out that this standard approaches geared towards raising awareness, they can only take us so far. And they are likely to be ineffective for a sizable portion of individuals. These people who we've seen in our research are distrustful of the source of information, and instead they rely on their belief, they rely on their intuition rather than on evidence. So by no means does it suggest that information or education should be abandoned. Of course not. Simply, they should be made more precise, and initiatives aiming to reduce vaccine hesitancy must be oriented towards the underlying cognitive factors, the underlying psychological motivations that we saw reflect differences in intention and behavior, rather than demographic segments that have little or no explanatory power in predicting people's behavior.
Thanks very much, Pierre-Jean, for the great overview and dive into the results. At this point, I'm delighted to take an opportunity to talk with a few of our partners now to try and contextualize some of those results and set the stage for moving into solutions. So we're going to be talking to Dr. Jia Hu, Dr. Noah Ivers, and Adam Froman. So the way I'll do this is a quick intro to each right before I ask them a question, so you're able to map the person to the question. So Jia, we're going to start with you. So Jia is a primary care physician, co-chair, co-founder of 19 to 0, and a member of Cleveland Clinic Canada's medical director program. He did his Doctor of Medicine at the University of Alberta and a residency at the University of Toronto and St. Mike's Hospital. Currently a medical officer of health with Alberta Health Services, he's played a key role in many aspects of the COVID-19 pandemic, including scaling up of testing and contact tracing, development of the mobile contact tracing app, assisting organizations with COVID-19 preparedness and reopening, and engaging in risk communications. He works part-time as a family physician at a clinic and a long-term care center that serves patients with complex medical, mental health, and substance abuse issues. So Jia, thanks for coming. And we were hoping that we could talk a bit more about 19 to 0, the group that you're leading. So this is a coalition of experts from public health groups, contains some academics, and the BE unit led by BEworks. So it'd be great if you could offer some thoughts on what drove the need for the creation of this group and how it's situated to address some of the crises that we're collectively facing.
Yeah, no, happy to talk. And sorry, I am a bit sick today, so I say anything crazy, it's blame me. But I think that, yeah, I mean, we sort of started off recognizing, I think, that we had, public health, which I'm part of public health, had a difficult time, reaching people who weren't necessarily following public health recommendations. And so this is late last summer, early into the fall, as all of our provinces sort of spiraled towards the lockdowns that we then experienced. As vaccine became more present on the horizon, I think the same logic applied. Prior to COVID, I did work primarily in what you might call vaccine hesitancy, vaccine uptake, in those fields. And I think that, we as a society never really had any good interventions to deal with vaccine hesitancy. We're not so good at doing the sort of the mass marketing stuff, not so good at addressing issues on social media, not so good at addressing conspiracy theories. And, the stakes just have never, vaccine hesitancy always been a problem. Spiritual thinking, more and more a problem. But the stakes have never been this high, right? With how COVID's affected society. I think that we are very, intervention focused. And so while it's critical, we do collect data, very critical as well. But we are sort of looking for things that will actually change people's minds. And, sometimes that's a recommendation from a trusted healthcare provider, but they got to know what to say, right? And sometimes it's, a little big marketing campaign, but at the end of the day, I think incorporating some of the thinking from, behavioral economics lens really cuts to why people do what they do and why people don't do what they do. And applying some of those cognitive lenses viewed as just quite critical to actually changing people's behavior. It's not something we've ever been really good at in healthcare or public health, right? And so I think that's why I think incorporating this type of thinking is so important.
Yeah, appreciate that. That's great. Certainly, as you said, more critical than ever. So, as another question, I guess, something that would be interesting for everyone here would be to think more about why this sort of work with BEworks is so critically important, particularly in the context in Canada that it seems focuses on vaccine shortage, and would welcome any thoughts both about where you think this behavioral economics focused work should go from here, as well as, a call to any of your colleagues in public health that might be quite focused on shortage, but maybe should be thinking more about hesitancy and getting people signed up.
Yeah, I mean, I think that the shortage thing, I mean, it certainly has been top of mind for most people, given how, I mean, it's in the media all day long. But, you know, the fact is, like, at some point, the shortages will be sort of overcome. And, you know, we saw some recent announcements, you know, we're resuming shipments of the Pfizer and Moderna vaccine. And, you know, Trudeau basically says we'll have enough for 14 to 15 million Canadians by the end of June, which is actually not that different from what we were thinking in December. And so I think that, you know, that we, like, in some ways, in many ways, actually, I would say, like, getting the vaccine is the easier part. That's sort of a technical challenge, but changing people's behavior has always been something that we've struggled with in anything, right? As we talk about like obesity or talk about smoking, though we've done a good job with that. You know, we talk about all the things, the health promotion things we want people to do, including getting vaccines. We've never really had a good handle on it, I would say. And I think that's why incorporating sort of new ways of thinking, like the behavioral economics approach, which has been used effectively for all sorts of things in terms of changing people's behavior, is so critical. You know, another piece I'll say is that right now, yeah, we're facing a bit of a shortage. We won't be facing a shortage 2 months from now. And, you know, for once, we have some time to prepare. And, you know, I think a common critique of public health is that we don't prepare for the next thing around the corner. And now we might as well take advantage of the time that we do have to prepare. You know, I think that really what drives vaccine uptake or lack thereof is this notion of, like, is trust. Yeah, there's the science. You have to know a thing or two about how the vaccines work, but it's really these, like, it's the way you think about the vaccine, right? Do I trust Health Canada? Do I trust public health? Do I trust Trudeau? And if we can't change those underlying behavioral factors, we're not going to get anywhere necessarily, right? Like all the messaging around don't wear a mask or get a vaccine is so basic, right? They don't address the underlying issues. And we need to sort of like unravel sort of the underlying drivers and interventions that are working against that. And that's sort of what the behavioral economics approach seeks to do. And so I think everybody should sort of, you know, like come on board and think about deploying it and how different strategies are employed. And is beyond just, you know, like mass marketing campaigns, right? I think we'll use this to inform how we work with our community groups, right? Because our community groups will drive change in the vulnerable populations. They need to know sort of what to say, right? And, you know, there's already a sense that the reason why certain populations like, you know, Black Canadians or Indigenous populations don't want vaccine as much is because there is sort of a broken trust between them and government. Is sort of inform that. It'll inform all the, you know, any of the ways we attempt to address misinformation on social media, right? Which is again driven by a lot of this conspiratorial thinking. And it will ingest like mass marketing campaigns as we do those. And so it's just an incredibly important a little toolkit to really drive behavior change, which we need to get right and which we haven't been so good at getting right in the past for any health related issue.
Yeah, well, thanks so much for your contributions to our efforts on this project more generally and for today's webinar. Hope you're feeling better soon. I'll let you off the hook now. So up next, I wanted to ask Dr. Noah Ivers a few questions. So Dr. Ivers has an MD as well as a PhD and is a family physician at Women's College Hospital. Also an associate professor at the University of Toronto and a Canada Research Chair in implementation of evidence-based practice. So Noah's role lately with 19 to 0 has been helping to lead the healthcare worker arm of the coalition. And this is centered around data-informed behavior change campaigns. So Noah, you have a really fascinating seat at the table in that when it comes to vaccination, you're working with public health groups, but you're also a practicing doctor and a behavioral expert. So I think you have some really interesting insights that you could offer to the group. So I think to start, it'd be great if you could offer your perspective on the nature of the challenges we face if we can't get ahead of this from a behavioral lens and get demand up, as Josh said, as supply increases.
So first of all, really grateful to be here. And I want to thank the whole team for inviting me and for doing this really, really important work in partnership with all the key stakeholders. And I think I want to start by answering your question about, you know, just touching on what Ja was saying, which is that our great challenge is about engaging trusted community members, including healthcare workers like myself and my colleagues, so that they can effectively advocate. That's really where I've been focusing. I think we have pretty good evidence that religious leaders, faith leaders, and healthcare workers can act as effective advocates because they hold a place of trust with community members. I think there are likely other potential community leaders that could be leveraged as well and should be. And I think we're not doing a lot to do that yet. When we're going to healthcare workers, we're giving them 3 key messages. We want them to get knowledgeable. They need to know the facts. But as was so helpfully highlighted, just using them to deliver the facts is not gonna get us there. So the next key message is that we need them to get vaccinated themselves. We need them, anybody who's seen as a role model, to role model getting vaccinated, to talk about their experience getting vaccinated. You know, as a family doc, when I say something like, you know, it's good enough for me and my family with my patients say, all right, doc, you know. And of course, we want them to have a full informed conversation, but that trust can really be leveraged in that way. And the third key message we give to healthcare workers is that we want them to get skilled, because as was highlighted, there are better and worse ways to communicate about the situation with folks who are on the fence, so to speak. And, you know, first and foremost, it is normal to be a little bit on the fence. It is normal to have questions about a brand new situation that none of us have ever been in before. And I think we want to help community leaders, including healthcare workers, have a structured approach to handling that is informed by understanding the underlying determinants of behavior and beliefs. And then, you know, I'll just add one other thing in terms of challenges as per your question, and that is about equity. And it's been raised a couple times in the chat, and Ja touched on it. You know, I think there's lots of reasons why we see inequities in health and healthcare outcomes, and most of them have nothing to do with healthcare specifically. They're structural and social determinants of health and wellness. And, you know, many viewers may have seen the map of Chicago where, you know, early in the vaccine rollout, the map of who is getting vaccinated versus who is getting COVID are not, you know, overlapping at all. So it's a major problem, and you know, we need to solve that challenge immediately for the good of everybody. Yeah, I'll stop there. That's long enough.
Yeah, appreciate it, Noah. And maybe just one other question to summarize some of what you're talking about is when you look at the landscape from the vantage of both the front lines and the research, do you think that currently most doctors and healthcare frontline workers are equipped for this? Or, you know, because we're talking about conspiracy-based theories and a variety of these complex beliefs, so I just would love if you could leave us off with some thoughts on our readiness for this group to help address these challenges.
I would say that this is a great question. I would say that we're working on it, but I think we have to acknowledge that guidelines don't self-implement, and delivering facts to healthcare workers is not going to address the deficits or the challenges with these conversations. These conversations are fraught with emotion, and they're fraught with, and they require skill, not just facts to overcome. And so we probably need to build those skills around storytelling, around engagement, around truly hearing somebody and validating some of their concerns while not validating things that are not factual either. So we have work to do.
Yeah, well, and we're grateful for the partnership and for you lending your thoughts today, and look forward to trying to take on some of these challenges. So thank you. And as our final guest here, want to turn now to Adam Froman. So Adam is the founder and CEO of Delvinia, who's grown that firm into a globally competitive group of companies over the last couple of decades. So it started as a traditional digital consulting company and is now classed as an innovation company that invests in identifying ways to bring next generation products, services, and business to markets. Adam's very active in a number of areas beyond the growth of his own organization, including the Canadian Marketing Association, Market Research Education Foundation, and on the board of directors for the Council of Canadian Innovators. So Adam, in thinking about what you can share with us today, I think it's imperative to recognize the crucial role that you and Delvinia's Asking Canadians panel plate in turning around this data in a very timely manner. So it would be great if you could offer some insights onto how this work came about and your sense of why this sort of research is so critical.
Well, Nate, thank you for having me and being part of it. It's, I think this work is very important to be a part of as well as to support. Kelly reached out to me mid-December, and I think as we're a growing technology company, and we are part of dealing with people going through the pandemic, which is probably the largest mental health situation that any company has had to face in our lifetimes. And when Kelly called me up and in somewhat of a panic, because we've known each other for over 20 years, and we're always happy to talk to each other about supporting our businesses. She called me with the situation that while the pandemic was still running very strong, the discussions were moving towards how are we going to get the vaccine, and the concerns around hesitancy, and her work with 19 to 0. And what she presented to me was that some of the research that was coming out just wasn't where your organization was aligned to think about, and it wasn't taking a behavioral approach to it. So literally in an evening of a series of flurried texts between Kelly and I, you guys, BEworks is already a client of Delvinia and Asking Canadians. It was really not much of a challenge to step up and say, how do we support you to get this important data so that you can, prove your hypothesis of what you think should be done? Because the time was not on our side. It was, we're in December, things were moving ahead in the new year. So amongst, our fourth quarter, especially this year, we had been affected by the pandemic like everybody else, but our fourth quarter became extremely busy. But I realized the importance of getting this research moved ahead, and my team was able to mobilize under a very short period of time to support your group to collect a significant number of completed surveys to really allow you to keep your momentum going. And I'm very honored to be able to be a part of it, and really happy to support Kelly and BEworks through this.
Yeah, we deeply appreciate it. We're glad to partner on this. So being mindful of time, we have quite a few solutions to review. So I thought before we get back to the solutions, maybe just in a few sentences, Adam, if you could let people know about some of the other resources you've offered related to the work with CAMH, so that we can point them there, and then we'll get back to walking through what some of the research we did together could mean for solutions.
Right. So as because our organization, we're a data collection company. So we own Asking Canadians. We own a research technology platform called Methodify. We weren't going to make PPE last year to help with the pandemic, but what we were able to do is collect data. And what we're trying to do is participate where we can to help organizations get ahead of the curve. So last year, we ran 7 surveys with CAMH on mental health, right from May all the way through to September. And what we did was, not only did we run that data with CAMH, we made the data available for free for all researchers that could download that from our Methodify platform. And what we're doing with this was one of the questions I had for Kelly, because it is so large and such an important issue, can we also make the data available through this exercise? And next week, we're going to actually make the data from the survey available for free. And people can come to the Delvinia website so that we can help, everybody can help move ahead. And this data is really interesting to me because not only is it so timely, but it has such a unique approach because of your behavioral economics approach to solving problems. So I'm really honored that we're able to do this. And if any of the people listening want to go to the delvinia.com website or reach out to me, we can make sure that they're aware of how they can get access to this data after, and then sharing the knowledge and moving this important research forward.
That's brilliant. Thanks so much, Adam. We appreciate your contributions today and on the broader initiatives, and look forward to trying to work together going ahead. So with that, much appreciated to all of our partners for contributing today. And at this point, we're going to kick it over to Sarah Carpentier, one of our associates, to talk about what these results might mean for solutions.
Thank you, Nate. And thank you to everyone who's gone before me and who's engaging with us. This is obviously a really complex topic, and we're excited to be having a lot of the conversations that we're having and continue them, right? We have 60 minutes today, so there's a lot that we'd love to talk about. So what we're going to move into is how we approach solutions. And the main point there is that we have sciences to track the virus itself, how it spreads, to develop vaccines. And we do also have a science that follows the same evidence-based approach for human behavior. Behavioral economics unpacks the social, cultural, psychological, and emotional factors that influence why people make the decisions that they do. I had someone say to me once recently that, oh, I guess it turns out that epidemiologists should have had more psychology training. And I said, no, that is a whole discipline. And those experts need to be leveraged, and we're here for that. And we're here for that human behavior side of the vaccination challenge and the COVID challenge. So we can move forward a slide. Thank you. So with our approach, that we're talking about today, we didn't just conduct a bunch of research into cognitive factors of vaccine hesitancy and vaccination intentions for descriptive purposes, but because the understanding of those biases and those cognitive factors helps give us an evidence-based, prescription or roadmap for which interventions should be effective. And then when we implement interventions, we monitor and evaluate their effectiveness in order to update our approach with that latest evidence to really make sure that we're on the right track. So when we move into kind of basic BE foundations, there's kind of general evidence-based principles or foundational principles of communication that we can pull from behavioral economics. And it is worth mentioning these because they are important concepts to keep in mind as things that can probably be applied very broadly across most interventions. But then when we offer, and these are written about in our report, you can read a little bit more about them. These are things that probably some things, you may have already heard. Let's try and be concise. Noah did a great job talking about not just relying on these cold hard facts and then putting the onus entirely on the person who's listening to them to interpret them correctly and to, assume that somehow during, as Adam touched on as well, during this intense mental health situation that we're all in, that people are going to process them, free of emotion. That's an unfair ask of people. So, but then we can, what we offer in the subsequent sections are strategies where we can start kind of moving into the next level up of things that we can think about and want to consider for what might be tailored to, the specific vaccination intention segment, the specific cognitive factors that are relevant for each of these vaccination intention groups. So we know from our research that individuals who report that they are planning to get the vaccine as soon as it is available to them, they are scoring higher than other people, right, on trusted institutions, scientific knowledge, and are much more receptive to empirical data. So these are the people who have been responsive to a lot of the regular initiatives that are out there right now, just putting the information out there and saying, trust us, this is right. But we do also know that these are just stated intentions, right? So we can't take for granted that everyone who today or on the date of this survey said that they will get a vaccine will actually follow through next week, 2 months, 6 months from now, hopefully sooner than later. So there is still a very real risk that a lot of these people will backslide on their intentions. And we know there's a host of barriers to not only maintaining these intentions, but converting them to action when the time comes, right? We have the risk of the free rider effect. So people know it's important to know that people need to do it, but when it comes to it, enough other people will. I would do it, but I don't really have to, right? That's you can kind of think of it as the bystander apathy as well, and there's regular procrastination, and let's be honest, no one likes needles, right? So there's lots of those kind of things that get in our way. So when we start thinking about strategies that we really want to move beyond just directive, information messaging, is we want to empower these individuals to hold strongly to those vaccination intentions, and then also by doing so, create a social proof situation where they potentially sway some of the on the fence people as well. And then at that same time, design messaging and environments that are going to convert those intentions to actions when the time comes. So as an example of putting that into action, empowering these individuals to make public commitments, works towards achieving both of these goals. You'll strengthen and solidify their resolve to vaccinate. People don't want to go back on their word, right? If you've publicly proclaimed yourself as a supporter of something. And it does also serve to create that social proof environment, to create help create a safe space. So it's not about being a debater. It's about, and necessarily saying these people need to go out and actively take up some sort of torch, but it's about creating positive social signaling that helps individuals feel more comfort, safety, and security in vaccination. So to that end, one of the initiatives we're unveiling right now, as you can see on the slide, are social media badges, start building that social proof and that social signaling. So then when we move into our on the fence individuals, these are those people who truly, those undecided voters who truly could go either way. And let's remember that, inertia is working against us. Doing something is generally harder than doing nothing. So the easier path is not getting vaccinated. So these individuals are generally, have the option of the opportunity to being swayed by some of the people in the opposed group. And we do want to help them end up on the healthy side of the fence. So we can, simplify and describe that there's kind of two main factors of our sources of hesitation in the on the fence group. So concerns about the science, concerns about risks surrounding the vaccine, risks surrounding the medical, establishment, and some sway from opening the doors to conspiratorial thinking. So scientific concerns are very reasonable. As a scientist, I have them on a daily basis. It's actually my job. So we applaud everyone's curiosity and skepticism about science. I think skepticism is truly one of the most important things in being a scientist. Curiosity is a good thing. The issue comes up with where these people in their concerns are turning to for expertise and information. And that part is a little bit broken. So supplying these people with data and scientific information from government and what we consider to be the traditional knowledge producing institutions is going to, continue to do little to accomplish attitude change, because there's a lot of mistrust for various reasons that we can all, talk about later when we have a lot of time. That is its own conversation. But mistrust in the sources of those information. So the conversations we want to have with people, the ways we want to engage with people, the messaging we want to send, the environments we want to create, it's not about just resolving, as Noah touched on, resolving concerns for vaccine safety by saying, oh, this, oh, that, and providing information, but including talking about the sources of that mistrust, right? It's not a battle of what's true and what's not true. It's about understanding where the communication and where frequently the disenfranchisement is coming from, right? Building some empathy around that and really actually trying to do something to solve some of the distrust in those institutions. For a clear example that is certainly relevant in Canada, and there may be parallels with either the same or other communities in your home country, let's not just be aware of the ongoing disenfranchisement of Black and Indigenous Canadian citizens, but let's make sure that we are paying strong attention to their perspective, to the perspectives of those communities, and incorporating those perspectives into strategies in order to help people who are some of the most vulnerable in our countries stay healthy. So with these individuals as well, the on the fence group, what we're seeing in a lot of their responses is that there's a gap. There's been a failure of the systems, of the environments that they've been in. There's a gap, there's a deficit in media literacy and critical thinking, education, and skills. And this has left too many people in a place where they're missing those, technical chops to know what is good information and what is bad information. And again, we can talk about how we got there, but it is a product of obviously, certain environments. Who to trust who a good source is compared with, someone else who's telling you things you want to hear, but maybe they have ulterior motives and they're giving fake information. So take that foundation of thinking style and compound it with the emotional fear of the pandemic times. And, we've ended up in a situation where a lot of people are using, cherry picking and motivated reasoning. So motivated reasoning is people develop an attitude through intuitions, emotions, and gut responses, and then they're motivated to find specific pieces of evidence that support that particular attitude. So public health leaders need to go deeper into their science of communication expertise to serve as that broker between the information and the citizen and help build those connections. Repeating evidence is not going to be effective for these people because it fails to address the underlying reason for why they're processing the information in a biased way in the first place. So some of the strategies that we also want to consider with this group is, obviously then in the first place we can start thinking of is, where does the trust still lie, right? So Noah talked about this as well, having messages that are, most appropriate for who they're aimed for, delivered by, individuals and organizations that they do trust. We also found that vaccine hesitant individuals will benefit from strategies that really appeal to their self-concept as someone who makes their own decisions. I am a rational, independent thinker, and people don't tell me what to think. I choose what to think. They want to do their own evaluations and they want to come to their own conclusions. Feeling that way is very important to them. This group strongly reported that they're concerned that the vaccine isn't safe, but they want to do their own research, but they haven't had the time. So while they may not actually want to spend hours and hours and hours doing that research, they certainly want to feel like they've done their due diligence. They're signaling that they want to have that feeling in themselves and they want to feel like they've made their own decision. So providing them with tools that simplify that process for them while still helping them feel like they have, made empowering progress to that end should be quite effective. Biased and motivated reasoning is making some of these members vulnerable to conspiracy theories. So we do need to engage with them, not as a battle again, but it's really about trying to understand where their deep mistrust and disenfranchisement is coming from and building some empathy around that. So if we move to the opposed individuals, we can start out by saying that we don't want to engage with these individuals in a shaming way or coming at them like we're trying to battle some misinformation and we are going to convince them they are wrong. This is just going to continue to fracture our families and our communities. So as difficult as it may seem initially, we want to start with that same concept of perspective taking and empathy and try to connect with people and understand their positions of grievance that are born from something they have going on, their social, their economic instability, their perceptions of things that are important to them in their lives that are askew and not working out for them, and that is making them vulnerable to opening doors to alternative things that are providing them with some comfort. So these people do believe that the things they believe that it's mind control, it's a ploy for population control. They believe these things very, very strongly. So, right. So coming at messaging with them saying immediately from the standpoint of you're wrong is not going to be as effective. There are people in this group who are looking for answers, and help and comfort are looking for help and comfort is causing them to end up as victims of other people who are waging misinformation wars. So we want to take an approach of engaging with the goal of connection rather than just taking the mindset of engaging with change to, yes, increase their receptivity to information. We do ultimately want to have them, take consideration new information, but also minimize how actively they're engaging in the spread of misinformation and attempts to sway those who are on the fence, right? By reducing their desire to use some sort of platform as an emotional outlet for the stress and frustration that they feel. So on that note, I know we have a lot to talk about. I covered a few things briefly. I'm so excited to engage in any conversations with anyone else, either on the topics I talked about or other avenues. And Warda is going to tell us about more opportunities for, putting some of these principles that I outlined into concrete specific actions and tailoring them for specific situations and populations. Thank you.
Awesome. Thank you, Sarah. Hoping everybody can hear and see me okay. I'm really excited to introduce a solution that we're calling Beacon, which stands for Behavioral Science Accelerating COVID-19 Recovery. You know, one of the key things that we often hear is, yes, we've done the research and we've walked you through just a very small sliver of the possible solutions that can be at play, whether applied to public health issues, whether applied to large organizations. We did see a question in the panel as well about, you know, what responsibilities do employers have? And we certainly think that, you know, there's a way to communicate about the importance of vaccination, even within an organization. So skipping to the next slide. Slide number 26, please. You know, one of the key things as we're just moving along is on the front page of the Globe and Mail today, there's a notice about concern and uncertainty surrounding vaccination plans and the need for us to be able to move quickly. This Beacon solution is a sort of 4-week rapid sprint where we seek to understand vaccine intent, things like, you know, other solutions to reopening the economy, like openness to rapid testing, and just reopening readiness amongst the population. That then translates into the design of targeted communication campaigns. We talked a lot about BIPOC populations, you know, in this work, and the importance of really taking a specialized approach to these groups, just given the history that they've endured and the different reasons for hesitancy there, but also applying it to different populations. So a part of what we're doing with this solution is helping you get the communication campaigns targeted to your particular population. And the third thing is supporting in rollout to help people make better decisions when it comes to getting the vaccine. So to learn more, I know that everybody's who's registered will receive an email in the next few days, which will contain the recording. It'll contain the summary of these slides. And also please look forward to a solutions report that'll be coming out in the next few weeks. So we want to thank you all for joining us for this session, and we look forward to chatting with you all in the future. If you'd like to learn more, please head to beworks.com/COVID-19. Thank you so much.